Hello, I am Dr. Divyasree, consultant at Kangaroo Care Fertility, Bangalore. Today I will be talking about evaluation of infertile couple. So before going to evaluation of the fertility couple, we'll just talk about the basic requirements for a normal pregnancy to happen. So in a female reproductive system, they have a uterus, two tubes, right tube and a left tube, and two ovaries, right ovary and a left ovary. So if the female partner is having a regular cycle, say 28 to 30 days cycle, one of the follicle in the ovary will grow and release an egg at around 12th to 16th day. Suppose the egg is released from the right ovary, it enters into the right tube, and if it is released from a left ovary, it gets entered into the left tube. So at the same point, if the couple is going to have intercourse, the sperms travel all through the vagina, in the cervix, into the uterus, travel into the tube and fertilize the egg in the tube. So after fertilization, the formed embryo will travel in the tube for another 3 to 4 days, and on the 5th day it comes, sits in the uterus and forms pregnancy. So for a normal pregnancy to happen, the female should have normal ovaries, and each ovary should have normal number of follicles, say like at least 8 to 10 follicles in each ovary, and the tube should be patent. There should not be any block in the tube. Suppose there is a block in the tube, the egg and the sperm cannot meet in the tube. So both the tubes should be patent, and the uterus should be normal. So the uterus should not contain any tumors such as fibroid or mass such as polyp or any infection in the uterine cavity, which will prevent this embryo to come and implant inside the uterine cavity. Few uterine abnormalities like congenital anomalies can also interfere with implantation of the embryo. And the fourth important thing is the sperm parameters, the male parameters. So the male parameter should also be normal to have a normal pregnancy. In case if everything is normal, that is she is ovulating, tubes are normal, uterus is normal, and the male partner semen analysis is normal, then within 1 year 80% of the couples will conceive, and the next second year 90% of the couples will conceive. Even after that, if the couple is not conceiving, it is the time they have to consult the fertility specialist. So if they have married and they are trying naturally without any form of contraception, having regular intercourse in the sense at least 2 times in a week, and there is no use of contraception, then within 1 year they have to conceive. Suppose they have not conceived within 1 year, they have to visit the consultant. Suppose if the age of the female partner is more than 35 years, then within 6 months of trying naturally they have to consult, because after 35 years the fertility potential itself will decrease. So they should not waste time for till 1 year in trying to conceive. So once they have tried for 6 months and they have not conceived, they have to visit the fertility consultants. And few couples have to visit the fertility consultants as soon as they are planning pregnancy. Suppose they have a previous history of some fertility issues. Suppose the female partner is having an irregular cycle, say if the cycle length is very less than 21 day cycle, or the cycle length is more than 35 day cycle, then they have few fertility issues and they have to consult as soon as they are planning for pregnancy. Or suppose the patient is already known to diagnose few conditions, such as if the female partner is having fibroid, or if she is having endometriosis, then she has to consult the fertility specialist. And in the same case, if the male is having few fertility issues, suppose there is problem with sexual dysfunction like erectile dysfunction or premature ejaculation, then they have to consult the fertility specialist. One more thing is, if the male partner is having a previous history of any trauma or surgery on the testicular area, then they have to consult the fertility specialist as soon as they are planning for pregnancy. So once the infertile couple comes to us, we do a basic test to evaluate their fertility potential. So coming to the female side, we do a basic ultrasound to see how her ovaries are and how many follicles each ovaries are having and how the uterus is. So this is the only 2 things we come to know in the ultrasonography. Suppose if the uterus is having a fibroid, polyp, adenomyosis, we can make out in the ultrasound, or if the egg number is less, or if the patient is having polycystic ovaries, we can make out in the ultrasonography. Similarly, the endometriosis can be picked up in ultrasonography, but the tubes are very thin. They cannot be seen under ultrasound. So to evaluate the tube, to see whether the tubes are patent or not, we have to do a dye test or we have to do a laparoscopy. So in dye test, what we do, we push the dye into the uterus, and when this dye enters into the tubes and come out of the tubes, then we take an X-ray. So that will capture the root of the dye and will tell us how the tubes are, whether there is a block in the tubes or they are patent. So these two evaluations from the female side, that is an ultrasound and a tubal testing, will tell her how her basic reproductive system is. And from the male side, we will be doing a semen analysis, a basic semen analysis, which will tell us about three important parameters. That is, we will know what is the count of the sperms, what is the motility of the sperm, and what is the morphology of the sperms. So usually a small basic semen analysis will pick up most of the problems in the males, whereas in females, apart from ultrasound and tubal testing, we have to do few hormonal tests also, like we have to evaluate for her thyroid status, a few hormones such as prolactin, and her sugar levels. So once everything is normal, or if there is some abnormality, depending upon the cause, we are going to treat the couple. So this is the basic evaluation what we do in a female partner and a male partner, and depending upon their evaluation and investigations, we will plan the mode of management and treat the couple accordingly. Thank you.